Hello, my name is Shelley. I'm a registered nurse educator,
Hi there, I'm Brenda, Administrative Secretary.
and together we work at the Chatham-Kent Family Health Team in the Medical Cannabis Therapy Program. Welcome to video 1. Before we get started, I do want to make a note that prior to COVID-19, these educational sessions were in a meet and greet classroom setting. However, to keep you safe from harm, we are moving the educational settings to this online version. Please be patient with us as we are learning new technology. So without further ado, let's get started. So welcome to video 1, General Information, Access to Medical Cannabis.
Cannabis, also known as marijuana, is not an approved therapeutic drug in Canada, as scientific evidence does not establish safety and/or efficacy to the extent required by food and drug regulations.
As such, Health Canada does not endorse the use of cannabis for medical purposes.
Patients may feel cannabis is more natural and want to try cannabis instead of other therapies. However, cannabis has its own known side effects and risks.
Furthermore, unwanted adverse effects can occur. Cannabis may even have drug to drug interactions with other medications you are taking.
It is important to try other standard treatments and therapies before trying cannabis, as safety and efficacy of standard treatments have already been established.
Unfortunately, medical cannabis is not covered by OHIP or most insurance companies. The average cost of therapy is $150 to $200 per month.
There are hundreds of compounds found in the cannabis plant: phytocannabinoids, CBD, THC, cannabinoid acids, CBDA, THCA, proteins, enzymes, aldehydes, ketones, terpenes, and flavonoids, just to name a few.
Cannabis smoke further contains known or suspected cancer causing chemical compounds.
Little is known about the uses, effects, and mode of action of some of these various compounds found within the cannabis plant.
As such, your physician, nurse practitioner, and the medical cannabis therapy program may not be knowledgeable about all the risks associated with medical cannabis.
The video we're about to review is a message from the Government of Canada titled, "If it's a plant, how can it be harmful?"
Nature is full of plants that contain compounds that can be quite dangerous if they're not used carefully or properly or depending on dose. Cannabis is no different.
It does have risks associated with it. We know that when people are smoking cannabis, that there are implications for their lung health, similarly to tobacco smoke.
Cannabis contains compounds which can affect mental health, can affect physical health in very important ways, depending on how you use it, when you use it, how old you are when you use it. So just because it's natural doesn't necessarily mean that it's safe.
Oops. Okay, so, all right. So, some of the common side effects of medical cannabis that I actually see in clinic may include, but not limited to, dizziness, nausea, diarrhea, dry mouth, drowsiness, fatigue, impaired memory, inability to concentrate, reduce appetite, increase appetite, weight gain, weight loss, anxiety, euphoria, paranoia, and hallucinations.
Adverse events are unintended effects, usually, but not always, associated to consuming cannabis that has a high THC content. Adverse events may include, but not limited to, fast heartbeat, irregular heart rhythm, heart attack, stroke, low blood pressure, psychotic episodes, or anything else requiring ER assessment.
Any suspected adverse events associated with the use of cannabis should be reported to the Canada Vigilance Program by reporting online at the following link, calling their toll-free number, or completing a vigilance reporting form at the following link.
Cannabis should not be used if you are under the age of 25, are allergic to any compound in cannabis, have serious liver, kidney, heart, or lung disease,
Have a personal family history of serious mental disorders such as schizophrenia, psychosis, depression, or bipolar disorder.
are pregnant or are planning to get pregnant or are breastfeeding, are a man who wishes to start a family, or have a history of alcohol or drug abuse or substance dependence.
When beginning medical cannabis therapy, patients are cautioned to begin at a very low dose, to titrate slow, and to immediately stop therapy if undesirable side effects should occur.
In addition, when beginning medical cannabis therapy, it is best to have someone you trust with you in case you do experience an adverse event and require medical attention.
The scientific community continues cannabis research in many areas, including but not limiting uh, to epilepsy, multiple sclerosis, depression, irritable bowel syndromes, addictions, and cancers.
Phytocannabinoids and cannabinoid acids are being studied extensively and may be beneficial. Other compounds, such as terpenes, may somehow modify or enhance the effects of the cannabinoids, known as the entourage effect.
Clinical trials are being done all around the world. The future benefits of cannabis looks very, very promising.
In the next video, we meet the godfather of medical cannabis, Dr. Raphael Macholam, and his team of scientists, harnessing the next major breakthrough of medical cannabis.
Today is a great day. Every decade or so, a breakthrough changes the world, and its impact registers not just throughout its industry, but throughout humanity. This is one of those breakthroughs. We at EPM are motivated by the belief that humankind has one purpose: to help each other move forward. Now, we know that cannabis has incredible potential, untapped potential. But what if we told you that harnessing its true power requires no cannabis at all? This extraordinary breakthrough is the work of the world's foremost cannabinoid scientist, Professor Raphael Macholam. He discovered a way to synthesize molecules derived from cannabinoid acids, molecules that are stable, more potent, and industrialized. When it comes to creating effective new therapies, these are the ideal building blocks. This revolutionary process unlocks the true potential of cannabinoid acids. And we at EPM have partnered with Professor Macholam to share this accessible platform with the world. Cannabinoid acids can demonstrably treat illness and disease, and sharing this altruistic platform is not only the best way to ignite the creation of new therapies, it's also the right thing to do. So join us as we continue to unlock the transformative power of cannabinoid acids. Together, we can help create the architecture of the future of cannabis, the future of therapeutics and medicine, and most importantly, the future of humanity.
I actually had the pleasure of meeting Dr. Raphael Macholam and his team of scientists at one of the conferences I attended in 2019. So lots of potential, really interesting, exciting therapeutics coming. And I just hope that it's going to happen in at least in my time, if not all of our time. So anyway, in summary, cannabis is a very complex plant and expensive out-of-pocket cost. Cannabis may or may not be beneficial to you. The side effects may outweigh the benefits, and or you may have an adverse event requiring medical attention.
Cannabis is not for everyone. You won't know how it will affect you until you try it. Our goal in the Medical Cannabis Therapy Program is to help you harness any therapeutic benefit while keeping you safe from harm and improving your quality of life.
This concludes video 1. So thank you for being with us. If you have any questions, please write them down as we proceed. Some of those questions may be answered by the future upcoming videos. And if they're not answered by the end of the video series, then just reach out to us and we'll try and get those answers to you as quickly as possible. So Brenda is always available by phone, and she knows how to get in touch with me wherever I'm at, because I do all 5 clinics. Anyway, please proceed to video 2. It is titled Welcome to the Medical Cannabis Therapy Program. And again, thank you for your attention.